All right, welcome to the PhaseTwo podcast for our listeners who joined us for episode 2. Welcome back, and today we're going to dive in to a subject that is pretty popular here in Korea. It kind of ties into our last episode on health. We're going to dive into skincare, anti-aging, and cosmetic surgery.
Yeah.
So what do you think about that, D?
Well, I think it's a very interesting, very pertinent subject for where we are, Seoul, Korea. What did you say? We're like the number one per capita in procedures in the world.
In the world.
I also think it's interesting because this is kind of like a taboo subject in America for guys. Like, Chuck Norris never had a facelift. Clint Eastwood, Robert Redford.
Yeah, the nice beard.
The Marlboro Man.
Right.
It's just you tough it out, and this is not something that guys should be talking about, I guess, at least for our generation. But in Korea, the attitudes are a little different. This is I think it's the number one market, the biggest market in the world for cosmetics, like makeup and stuff for guys and all that kind of stuff. So guys definitely care a lot more about beauty.
So why don't we do this? Let me throw out some facts on what's going on in this scene in Korea right now, and then we can kind of talk about it. Like the thing is, like you said, like the way we grew up, I think it was kind of a taboo thing for men to talk about plastic surgery, but times are changing, obviously, and let's talk about some of the stuff that's going on in Korea. They say in Korea presently, there's over 1 million procedures a year, cosmetic procedures.
That's a lot.
We have the highest number of procedures per capita worldwide. So a lot of people, when they think about Korea, they think that it's basically like the plastic surgery capital of the world. Not only are we doing stuff here for our domestic population, but last year alone, the foreign patients brought in $189 million in revenue for the clinics in Korea.
Wow.
And in Seoul alone, there's more than 600 plastic surgery clinics.
Wow.
So, you're talking about the amount of just the sheer volume that we're doing here.
They're like Starbucks.
It's basically Starbucks. Like you could throw a rock in Gangnam and hit a plastic surgery clinic.
Maybe hit 2 if you could skip that.
So the thing is like it's so available, and one of the reasons that people are coming here is because it's cheaper than places like America or other places that people have it done. Like it just seems like with all these things that are out there, the misconceptions, the ideas on this, like when we talk about plastic surgery, what comes to mind?
Just growing up, 80s, 90s America, it was like something you're not supposed to do. Like for me growing up, obviously my perceptions have changed a lot living here for 15 years. Mm-hmm. But, you always think about Michael Jackson. Right. Like, this is what happens when you get addicted to plastic surgery. Right. And it was also kind of something that, your neighbors didn't do. It was like rich people or like Hollywood celebrities did. Right. And I think the perception in America at that time was just like more negative. Like there was more bad than good. Right. I think
it was more like, oh, you're plastic. You're from Hollywood.
You're fake.
Right? You're superficial. Like, why aren't you happy with what you have inside? Mm-hmm. Like that's kind of like it's like, hey, look, you're born with what you're born with. Like make do. God made you this way, so why change it? And if you're changing it, then there must be something going on inside you. You must be depressed. You must have an issue. And I think a lot of those ideas are changing.
Well, yeah, it's weird because obviously my wife, she's from a younger perspective, and she worked in a plastic surgery clinic, did a lot of procedures and stuff. So she has a different, and we talk about this a lot. Right. And obviously she doesn't see anything wrong with it. I think nowadays the attitudes, most people, I don't think see that much wrong with it.
Right. I think like the way we grew up, at that time, the perceptions, the ideas on this was a very negative thing to do. It's like, why? What's wrong with you? There's a deeper issue there. And then now things are changing, and it seems like if it's affordable and it's out there and it's available, like why not? Like, why is it a bad thing?
You definitely don't want, if it was like super expensive, you definitely wouldn't want to mortgage your house to look 2% more beautiful for something that doesn't like affect your job. It just affects your, you know what I mean? Mm-hmm. But, also like you were talking about procedures. What did you say? Like 1 million procedures performed last year? Or?
Right. Per year. And it's going up. Like in a US based thing, they said, statistically since 2000, they said that the number of procedures for men specifically has gone up 29% since the year 2000.
Okay, so what counts as a procedure is like, because like you're doing things to change the way you look. So like people get braces, we talked earlier about like hair transplants. Is all that count as?
So like when they're talking about these procedures, they're talking about surgical, invasive, and non-invasive. So injections, fillers, basically anything that you could do at a plastic surgery clinic. So they're not including braces. They're not including things like that orthodontists would do. They're saying strictly cosmetic at a cosmetic surgery clinic.
Okay.
So then they're talking about like, facelifts, nose jobs, boob jobs, the Brazilian butt lift. Like they're talking about all these things that have become commonplace in our vocabulary now.
So I know like in Korea, they have that kind of that argument where it's like, oh, I never got surgery, because surgery just kind of, in the old days, we just said plastic surgery. Now we say procedures. We have different. Right. So Koreans will say, oh, I didn't have susur, I had shisur, like, which it could be a filler, an injection.
Well, I think the lines are kind of blurred, like, because obviously we're on the outside looking. I've never had a cosmetic procedure. I've had reconstructive surgery on my knee, Achilles tendon, and stuff. It didn't really help my face look younger. But there's invasive and non-invasive, and so I think people are thinking differently on these procedures now, where they're looking at, are they cutting you open, or are they just injecting something in you? And I think some of the people are looking at those procedures as like preventative. So some people consider them plastic surgery and some people don't. I think it depends. I think me and you and people from our generation would probably say that it's all surgery. Yeah. But then people nowadays would probably say, no, that's just a maintenance thing.
Like Botox.
Right. Like things like that. I don't think they consider non-invasive, non-intrusive procedures to be surgery.
So also I've noticed younger and younger people, it's not people who's like are in their 60s and they're trying to get a facelift. That was like what we used to think, where it's highly invasive. You pull the skin back and staple it,
face off.
Yeah, to me. And then you'll kind of have that crazy grandma got a facelift look.
Right.
People in their 20s are getting Botox. So I always thought Botox was like, because you get this puffy look, right?
Right. So I think that like and this is something that like I was like researching pretty heavily. Like I didn't know the difference between a filler and an injection. And those things are different. Like when you're talking about Botox, you're talking about a neurotoxin injection.
So what does that do?
So the neurotoxin injections, what they do is they block nerve receptors, and they'll prevent wrinkles and lines, like basically in your face, right? So typically people will get them in the cheeks or on their lips, where we get crow's feet, and then in your forehead.
So you can't make certain expressions.
Well, basically, right. So basically we'll like relax and numb those muscles for a certain amount of time. So like say you get an injection now, in 3 to 5 days, you'll feel it, and then it'll last for 3 to 5 months.
3 to 5 months.
Right.
And then you just got to keep going back for the juice.
Right. I think like, it's a very common thing in entertainment from what I'm hearing now, that like a lot of the people are doing these as like a maintenance thing. Like this is just part of their anti-aging skincare treatment.
Well, I remember watching on Korean TV, and it's just out in the open. Like it's not even a thing. There was this older comedian on a show, and everyone was like laughing at her because she was like this, like her face was frozen. And she said on the show, she's like, oh, sorry guys, I got Botox yesterday. So I'm not really making this expression. My face is frozen.
Right.
And it was just like a funny thing. It was like very cavalier. It wasn't like no one was pointing fingers at her or judging her. It's just, that's what people do.
And I think out here, I don't think it's like a taboo thing at all. I think they're very honest and open about it. I mean, you walk around Gangnam, you see people with bandages on. And obviously they've been at one of the clinics, got a procedure done. What I think is in America and some of the other places, I mean, I don't know, I guess haven't been there in a while, but I would assume that it's still a little different, but maybe it's changing. I don't know.
Well, okay. So when I went back, I met with childhood best friend, and he had mentioned, and it was kind of like hush hush. He was like, and I was like, man, you look great, bro. Because most of my friends on Facebook from high school aren't, they just look their age. They don't. We were fortunate to play basketball indoors, not getting all the sunlight. But, a lot of my friends that, live in LA or Miami or whatever, it ages you. Right. And I was like, man, you look great. You don't like look like all the other people that I'm seeing from our class on Facebook. And he's like, bro, I get Botox like every now and again. Like it was like, I think there's still that thing. Otherwise he would have just said it out in the open, but it was kind of like a hush hush. Hey, because we're boys, let you in on this.
Well, I think that kind of brings up another interesting thing. Like for men specifically, I think for women, like women have been getting procedures done for a while. And I think they're open about it. They're talking about like, did they get their boobs done, their lips, like their eyelids, whatever, you know, they're yeah, you know, I got this done. Or they got done so early that you can't tell, and you're like, no, I've always had these. But then you look at it like an elementary school picture and you're like, wait a second.
Wink, wink.
Right. But I think for men in general, like men more go towards the kind of procedures where you have that exact response. Like, man, you look good. What, did you stop drinking? Like,
Yeah.
Like,
You change your diet.
you look like you don't have any stress. Like, why do you look so good and bright? Where like these other small procedures, like say getting like a fat like displacement on your eyelids or whatever, these kind of things like are probably more what men are going into because they want that feeling of like, I didn't have surgery, I just have changed something.
Yeah.
Like not like a whole thing where like, you know, all of a sudden like you meet a girl and you're like, wow, have you always had D cups? and then now like, you know, like how can you, those kind of things for guys are a little more, you know.
Definitely the shame factor has kind of gone out of it, especially for women. You know, in Gangnam, right after they come, they'll just walk around. You see them at the coffee shops,
right.
And they'll have there's like badges of honor. You know, it's like I got the strap over my nose or whatever. It's like it's kind of saying, A, I'm affluent, I can afford it, you know, or whatever. I'm living a certain type of life. I don't know. There's definitely no shame in it. I might be projecting what I think is going on, but definitely not shame. Almost a badge of honor-y thing about it, you know?
I don't know. I think like,
or maybe not. Maybe I could be way off base.
I think people now, there's a whole lot of things going on. I think it's become more affordable. So I think back in the day it was a very expensive thing, and I think you know honestly now too it's gotten a lot cheaper, but it's still a luxury. You know, if you could spend $1,000 on a procedure, or you know if you have that expendable income, it's something that you probably consider. I mean, why not, right? Because it kind of brings up an interesting thing where if it is affordable and you're doing these things as like say like preventative anti-aging, like is it more of a wellness thing? Because I think like some people are looking at this like some of these things are anti-aging, some of the things are good for you, and if you look good, you feel better.
And I think that's like the wellness aspect, that because I don't know that it'll make you physically healthier, but there is that mental like feeling good about yourself,
right?
And that's a huge factor in your self-image, your quality of life,
right? Because I mean, like a lot of people are, you know, they've got gym memberships. They go to fly to Bali to learn from a yoga master, do Pilates, do all these other things. But if you don't have to do all that, and you can go and have a procedure and accomplish the same goal, like, is it a bad thing?
It could be just more cost effective. I remember I would join a gym in Latin America one time, and the slogan was, "Are you tired of being fat and ugly?" And they were like, join our gym and just be ugly. So it's kind of like, you agree that like people want to look good. Everybody wants to look good. Even if, you know, you're a man's man, Marlboro man, you want to look like, you know, however you want to look.
Right.
And so that's why a lot of people go to the gym. But the face is kind of a frustrating thing because there's nothing you can really do aside from these kind of things. And you just always have kind of had to accept how you're born, or you know, whatever, which is good. But if you could change it and it's affordable, it might be cheaper than spending money on therapists or flying to these yoga retreats and all this kind of stuff.
I mean, there's a whole industry like fitness. Like, I mean, you talk about vitamins. I mean, people are all trying to find a way to hold on to whatever kind of vitality they have when they're young, right? Whether they realize when they're older, like, man, you know, I just don't have the energy I used to. I wish I had that energy back. I need some fire back in my life. Or if you're a 20-year-old and you're like, man, I just feel lazy. I just want to get in shape. So then most people, the tried and true path has been to go get a gym membership, change the way you look, like feel better, you know, get those endorphins going and
get a pep in your step.
Right, do something. But then for some people, like not everyone wants to go to the gym. Not everyone wants to go do Pilates. Not everyone wants to go and sweat. And some people are just how they are, and they would just feel better. They would get the same effect by just going and have a simple procedure done. And like honestly, like gym memberships are expensive in Korea. So, I mean, it might be around the same investment just to go to a clinic and have an eyelid surgery or a nose surgery as to going and spending a year in the gym sweating your ass off.
Not really enjoying yourself.
Right.
All great. We're also like so busy that like, say you're this, you know, I can't relate to this, but say you're like one of these high powered lawyers or whatever, and you really don't have time to go to the gym. Like if you took 2 hours out of your day to go to the gym, that's 2 hours you could be studying for a case and winning and supporting your family or whatever. You can squeeze more in if you just get, say, a liposuction thing. If you're worried about your beer belly or whatever you're worried about, you could accomplish all that. Why would you go do something that you don't like doing? Nobody likes being on a stationary bike. I mean, I don't think.
So let me ask you this question then. We've talked about this. If you can accomplish your goal and just have surgery, is it cheating? Are you cheating the process? Because like the way we grew up is like you got to do the work. You got to do the work to appreciate the result. Like, you know, you got to do the work and you get the carrot at the end of the stick, right? But if you can get the carrot without doing the hard work and all the pain and everything,
wouldn't you just, the carrot.
You know? I mean, so is it cheating?
I think if your goal, it's whether you're more journey oriented or the destination, because I think like everything's a cheat. All the technology we have today, it's like, oh, you don't want to write a letter? Oh, so you're going to do an email? Like, you know, like that's a cheat for waiting a month to get a letter. Right. You know, you're flying, so you're not taking the month steamer to Europe, you know, like
it's efficiency. So
I think like if we're just talking about straight up efficiency, like, I don't know. I think that's probably just the evolution of society, because the society kind of evolves along the same arc as a technology. So
let me ask you this question. If the arc is going that way, and surgery becomes a commonplace thing where whatever, you know, you want to change your nose, your face, whatever and it's affordable and cheap, and they do it. Now everyone in the world is beautiful.
Yeah. So how do you differentiate yourself?
So what happens then?
The price of beauty goes down, right?
Right. Because it's like right now, like having a beautiful face, having a great body, these are still things that are pretty like
lofty.
You know, I mean, beautiful people are on TV, beautiful people are in magazines, beautiful people are on Instagram posing next to Lamborghinis, you know? So if everyone can look however they want to look by just going to visit a clinic, like what's the value of beauty?
I think even in Korea, where it's pretty commonplace, like no one's really gonna like shake their finger at you for getting plastic surgery. But if a girl has a really nice nose or something, they will make a point at saying, "Oh, this is my nose."
Right.
Like there still is pride in that, but then again, there could be somebody sitting right next to you that has identical nose, but they got it done at some office in Gangnam.
So do you think it would go the other way? Like if everyone had the perfect nose and then you broke your nose, they'd be like, "Oh man, what happened?" Like, "Wow, that's so dope." Do you think it'd go the other way?
Well, I've heard this too. I've heard like this was a while ago, but they were saying that a famous actor didn't want the perfect nose. He wanted it slightly just so it didn't look too plasticky, you know, like too like artificial. He got like a little bump, or I don't remember exactly what it was, but I think, yeah, you take away the individuality of everyone having their little, you know, quirks.
So they said like in Korea, right? So I've done some research on what happens in the United States, because that's where we grew up, and then now we live here, right? So they say like typically, if you break down the amount of people that have like these procedures done, the majority are women, right? Men don't make up a large part of that percentage, but the amount of procedures that men are having is going up, right? They say typically in Korea, they say 1 in 3 girls ages 19 to 29 have had a procedure.
Wait, say that again.
In Korea, they say 1 out of 3 girls.
1 out of 3. Wow.
Between the ages of 19 and 29 have had some kind of procedure done. But
that could be like a really small something, right?
Right. And like some, like other statistical agencies are saying that it could be over 50%. So they're saying it could be like 3 out of 6 girls.
Well, I know that the double eyelid thing, it's just like a normal thing. It's like a rite of passage. Like people don't even think about that as a procedure a lot of times.
So do you know what the top 3 common procedures are in Korea right now for plastic surgery?
For women?
Right.
Or just across the board?
Well, just across the board, because it's majority women.
Probably the double eyelid, I would think.
Right. That's one of them.
What is that called? You said the word earlier and I've never heard it.
Blepharoplasty.
What?
Blepharoplasty.
Okay, that's a
even,
mouthful.
I don't even know if I'm.
Blepharoplasty.
I don't even know if I'm saying it right.
Sankapursur.
Right.
But that's what I've heard. I've heard that since back in the old days. Like people were getting that.
Right.
And they've gotten better.
Right.
Before it was really obvious and
Right.
it just looked like,
Right.
whatever. Someone drew a line there. So the second one, I'd probably say nose.
Right.
A lot of girls want to raise their nose.
Right. They want the bridge, right?
Uh-huh.
And then the third?
Shoot, the third. Breasts. It's got to be breasts.
No. The third one is skin whitening.
Oh, yeah.
So like in Korea, because the majority of people that are having these procedures done are women. These are the top 3 in Korea, right?
Skin whitening.
And I was shocked at that too, because I didn't think of skin whitening as a surgical procedure.
Is teeth whitening a surgical procedure?
So I don't know. Like
I'm interested. How do they do it? Is something they like? How do you whiten skin?
I guess there's like some kind of like laser treatment that they can do at these clinics. Like they have machines, procedures. But I really don't know.
That's an interesting one.
I was shocked because like I was looking more at the actual procedures that were injections or where you're actually opening someone up. So I was shocked at the skin whitening thing. I didn't, but I guess that's one of the top cosmetic procedures that they have done in Korea.
That's weird because before the 2 that stick out in my head, just in Korea, is breasts and also the one where they crack your jaw.
They trim your jawline down.
And the reason, because that was in the news, because it was very highly dangerous.
Right.
I don't know it might be safe now, but when it first came out, people were, dying and,
That also has a really long name too.
What is it?
I forget. Even if I could remember, I couldn't pronounce it.
So what about guys?
So like, I don't know, like a lot of the statistics on guys I couldn't find. But from what I'm hearing from friends that have had procedures done, it's more of these like small, non-invasive procedures.
You wouldn't even know.
Like they're going for more fillers and for injections. And so we talked a little bit earlier about injections, and fillers are a different thing. So the fillers, what they do is they go deeper than the injections and they last longer. So you're basically like, when you get a filler, like a dermal filler, typically people are doing it in their jaw or their cheek area. And what they're doing is they're going to basically fill and give your face more volume and basically attack the lines that are in your face while your face is at rest. So the injections are relaxing these muscles and the fillers are going to give you like more volume, because I guess like some of that subcutaneous fat like leaves your face when you get older. Your face starts to thin out. And these fillers kind of put that volume back in. So like from what I'm hearing, these 2 things are really popular with men in Korea.
So fillers and Botox, I thought Botox was a filler. And then I was talking to my wife and she was saying some of the fillers, they like culture your fat cells and inject that back into your face.
So they say that basically these injections are actually anti-aging because what they do is they'll prevent wrinkles and they'll basically go in and help increase the collagen content in your skin. So it's like how'd you say this? Like it actually like there's a benefit for like a prolonged benefit, even though you have to keep on going and get the treatment.
So after you've put the filler in, it just dissolves, or where does it go? Like,
I don't know.
What if it's just pulling and just you get this big like sack in your chin? It just goes down.
Well, I think I don't know. Like from what I read, like,
obviously that's not the case,
right? They said that like people will go and do these things as like preventive treatments, and because they like the fact that they can feel and see something immediately. But then if you have a more like, say you're like a guy and you have like a lot of older men get those jowls, like where they have like a saggy neck. They'll go in and get that stuff taken away. They say these things are more like when you're younger. And if you have like something that's already, like these things can't cure like a saggy neck or whatever. You have to go and get like a more invasive procedure to correct those things. But I don't know. I mean, which also brings another point. Like we talked about this a little earlier. You're injecting this stuff in your face. Like the long-term lasting effect of injecting these types of things.
Do we even know? Is there long-term studies?
I have no idea.
You do it for anti-aging because anti-aging basically means you look young in the moment. Like for the next 6 months, you will be like in a time machine. You'll be 10 years younger.
Right.
But what if it makes you die 10 years sooner?
Right.
Like who knows? You're injecting stuff that's not naturally supposed to be in your body.
See, I think like gradually, like the language on this stuff is changing. Like where people are thinking about this stuff as anti-aging, whereas beforehand you're like, oh, let me buy a serum, let me buy an oil, let me buy a cream, let me get a mask, let me go get a facial. This is anti-aging because this will help my face feel better and slow down the aging process. Well, now if there's surgical techniques where you can get fillers, injections, and whatnot, and these are also considered anti-aging, what's next? And
It's
like,
kind of a fine line. If like, I don't know, and I'm just speculating, but if it takes, you know, these things that are foreign, like I guess injecting your own fat, to me, that doesn't sound like that would be so bad because it's already, you know, cultured fat cells from your body. But maybe a neurotoxin, you know, like, isn't that what you said, Botox? Is that what it's called?
They said, well, Botox is like a company that makes these neurotoxic like injections.
Okay.
So I guess there's a couple, like Botox is one of the most famous ones that came out earlier. That's why everyone says Botox. But they're
what is it? Is it a toxin? Or?
It's a neurotoxin.
So that doesn't sound good.
Apparently, right?
So, and you have to get it every 3 months?
Right. I mean, they say everyone is a little different, but they say what they recommend is around like 3 to 6 months that you have to go in if you want to continue to have the look that these injections give you.
So let me just take it to the nth degree. Toxin is like what? Another word for poison, right?
Allegedly.
So there's poisons in a lot of stuff, like alcohol, right?
Right.
Like eventually enough of that poison will take years off your life,
Right.
like alcohol. So this is another toxin that you're injecting. I don't know.
Well, I'm wondering like this, like if you take a lot of alcohol, right, your liver is going to take the brunt of that.
Okay.
So what in your body is filtering out these toxins?
Yeah, there's
Right.
so many questions like about the long-term health effects. And I think if it was a situation where like, okay, you need to inject a neurotoxin and that will help you beat cancer, you take the risk.
Right.
You're saying, okay, I'm taking a little bit of a risk with a little bit of a neurotoxin, but in the end, I'm going to defeat something that's going to kill me in 2 years.
Well, exactly. I think one of the problems with any kind of surgery or non-invasive invasive procedure is that there's no 100% guarantee.
Right.
So like anytime you're having anything done, there's a chance that something could go wrong. There's a chance that your body might reject it. There's a chance that it could become worse. And anytime you go under the knife or you allow something to be injected in your body, you're taking that risk.
Right.
So like, I mean, as good as the industry's become, and I think that we're living in a place like we're obviously like
Cutting edge.
I mean, like literally the cutting edge, you know, and there's still, you know, horror stories.
Yeah.
I mean, accidents happen, you know, like bad things happen, and it might be, you know, a fault on the part of the doctor, or it might be just something that happened in your DNA where your specific body is
Maybe you
gonna
didn't. Yeah.
you know?
So why do you think? Because obviously you said procedures went up like what 30% or what did you say?
Right,
It was like
29% in the United States for men.
in the United States for men. So obviously people are willing to take that risk.
Right.
So why do you think this is not a crucial medical procedure? It's not going to help you walk better. It's not going to help you, you know, live longer. I don't think. Why are people taking this risk for something that just affects their immediate happiness? What do you think? Like that's a tough question. Like,
Yeah, I don't know. I think that's exactly the question. It's like, what is the ultimate goal? Like, I think probably for when I think about it, I think it's probably like people just want to feel good. You know, they're looking for something to feel good, and they're thinking maybe if I could regain some of that youthful vibrance that I had in my face, or maybe it'll make me feel good, maybe it'll rejuvenate my life in some way. I think a lot of people have that same mentality when they go to the gym, or when you're going through midlife crisis and you buy a Ferrari. You know, I think like
not everybody can buy a Ferrari,
you know, or a convertible, whatever
Right.
it may be, or you take the vacation, or you buy something that you probably can't afford. And I think this is probably in line with that. There might be like, or it might be just people just want to look good. They just want to feel better about themselves. It might be like the same thing as going to get a good meal. I don't know. I don't know.
we were talking, we both watched that on Netflix, the new documentary, what was it called? Social Dilemma.
Right.
And a lot of what that was talking about was the instant gratification. Like that's why people keep getting addicted to their smartphones because
Right.
of, they see a notification, they hit the thing, and they're like, oh, I got 2 more likes or whatever it is.
Right.
And it's that little shot of whatever it is in your brain. Do you think that's kind of indicative? Is just kind of like how our culture is changing, like just that instant gratification? Like, I don't want to go to the gym. I just give me the liposuction.
Right.
there's kind of that conde mentality, like that old ajushi mentality. It's like you got to work for it, and there's virtue in working your whole life for a company or to get that body that you want. If you want it, you got to work for it. But what if you don't have to work for it?
I think people are less patient. I think it's exactly that. I think that people, they don't want to wait for 20 years to get what they want. Like I mean, when we were little, like people would say, "Oh, you want your cake and eat it too?" Like I think everyone that has a cake in front of them wants to eat it.
Yeah.
You know, I don't see the problem with that. And I think like if there's another way to solve this problem that is becoming a bigger problem, or maybe not, like why not? You know, I think like younger people now, the generation is different than the generation we grew up in. And I think the tendency for the older generation is to be like, how come you're not like us? You know, we did this, so you must do it so you can understand what we went through. But if they don't have to, then why? I mean, the object is to give the next generation a better life, right?
So with basketball, just because we both played basketball in Korea, is there anything that you have sour grapes about? Like when you look at the younger players, like, well, we had to live in the sukso and we could never go out and see our friends. Is there anything that gives you sour grapes, or are you kind of like, that's cool for you? Or is there like things that kind of like, oh, you guys didn't even know what it's like?
I don't know. I don't think like that conde mentality doesn't kick in so much for those kind of things. Like, oh, you guys should, you know, go and run the mountains like we did. You know, you guys should go up and wake up at 6 like we did.
Right.
I think it's more like, I don't know. I wonder how, actually, I don't really know. I haven't really thought about it.
I get some sour grapes, not so much targeted at them, but it's just kind of like targeted at the people at the top, where I'm like, see, look, now they're all thriving, you know, without all the crap that you made us go through.
Right.
Like they're not running the mountains and they're scoring 30 points a game. If I wasn't so tired, I don't know. I get a little sour grapes. I love the fact that the younger players are thriving. I have no sour grapes that their salaries are higher and all that kind of stuff. It's more just like, why didn't you do it for us?
Yeah, I don't know. I don't know, more than that. I think like I look at these kids and I'm thinking, you know, you guys got an opportunity to do something really great, you know, because they have the opportunity to like change and be whatever they want to be. And I think, I don't know. I hope that they take that opportunity. I hope they see what a valuable time in their life that they have. I think more than that, it's more like I see what these kids are doing, and I wish we probably would have done more. And maybe we could have spoke more, helped more, gone and done more with the platform that we had at that time. And I think some of these kids are taking advantage of that, and I think that's impressive. So it's more like probably like more so at the people at the top. Like if they would have allowed more freedom back then, maybe we could have done more. I probably have to agree with you on that one. You know, but yeah, I don't know. I think the kids are making good money. I hope they make good decisions with it.
And they're also like have more of a like platform to speak. They're all on YouTube and doing cool stuff.
I think it's like if you bring it back to like the social dilemma and that documentary that we watched, like you see these kids have more opportunity to reach more people. And at the same point in time, because that device is there to reach the world, you can see what's going on in the world. And that can be good and bad. So you have to really be conscious and filter that out, because like we were talking about earlier, like with these Instagram filters and whatnot, you can kind of see what you want to see, and you can create this reality that might not be reality, but it's reality for you. So it's like, you know, you see this stuff going on, and you can only really be where you are. So like for the basketball players, if they see, oh man, in the NBA it's like this, well, you're not in the NBA. You know, you're in Korea, so you have to, you know, work within these parameters. And if you're growing up in Korea and you want to have surgery and you want to look this way, so you put the filter on, and then you see yourself with that filter, but then when you look in the mirror, that's not you, and you become depressed.
Do you think that plays in to plastic surgery industry later? If you're a kid and you can't afford it and whatever.
I mean, they said like I was surprised at the ages for these girls, like 19 to 29. Like that's pretty young.
Yeah.
You know, like if you're, and like they said,
so a lot of those, they must be getting, like their parents must be signing up, like for a lot of them.
Right. And they said, I remember reading some articles a couple of years ago about kids having these surgeries when they were young, like in middle school and elementary, because if they wanted to be like an entertainer later, they didn't want to have to answer the question whether they had surgery. They wanted to have like the middle school photos match their today photo.
Oh, okay.
So they could have the surgery early, just in case someone asked them later. But no, I've always had these eyes. This has always been my nose.
Oh, they love to do that. And that's part of like the shaming that goes into it.
Right.
They love to find an old picture where you had like, just looked all jacked up.
Like a snaggletooth.
Yeah.
Or something. And I think that's kind of like semi-problematic. It's like if you're 10 years old and you feel like you're not pretty, or you're not handsome or whatever it is, and you think that surgery is going to change that, like at what point is social media enabling you, your parents enabling you, culture, whatever it may be, like, but to have these young kids have these complexes.
Yeah.
You know, I think that the industry is going to be the industry, that's fine, but like, are they supporting this? Like if a 10-year-old, like if a 10-year-old came to a clinic and like their parents like, yeah, I just want to, you know, my daughter wants eyelid, nose, and lip surgery. Like as a parent, what are you going to do? And if you sign off on that, what does that mean? And if the doctor says he'll do the surgery, what does that mean?
But my question is, yeah, like,
you know?
A 10-year-old is like a child that doesn't really know much. So what messages is she receiving on a daily basis from her parents, from all the adults that are supposed to be watching out for her and helping her, to where she's decided that in her 10-year-old mind that she needs this. Like, I think if that's the case, then we've probably failed as parents, as teachers, as a society. Like if these are the messages that are being pumped out on TV, I don't know. I just don't think that I think it's probably too early. Like if you're in that 19 to 29, you have your own thoughts and whatnot. But at 10, there's something sad about that for me.
Yeah, I mean, I would agree. I think, I think like it's a difficult thing because it's not like the industry is going to stop. I mean, they're making millions and millions of dollars, like, like with these like, cosmetic procedures and whatnot. And I think they're helping a lot of people with confidence and whatnot. They say like in America, like one of the most common like reconstructive surgeries is like dog bites. So if you're getting bit by a dog and something happens or car accidents or whatnot, then I mean, reconstructive surgery, cosmetic surgery, like makes sense,
Yeah.
Or like burn victims and whatnot. But then like, then there's the other end, where you have like the young kids that like feel inadequate and why, and I think that comes back to what you're talking about. Like, well, what are the people around them doing? Like what is social media? What message are they hearing that they think that they're not adequate when,
and like when they talk about it, like at least a long time ago when I used to watch, be in the States watching Oprah with mom, they would have these discussions. And at that time it was more like, well, if you were born like with some kind of a defect but nowadays you see like pretty people people are already pretty, getting plastic surgery and then going back and getting more plastic surgery and kind of getting this addiction. And then in the really worst cases, they were already fine. And then there's the case of the Sampungyajima, who was pretty to begin with and then kept doing it and kept going back. Well, and then until you just look like a circus kind of thing.
Well, they said that what happens a lot of times is you go in for a simple procedure, right? Like say, whatever procedure it may be, let's say like you going to get a nose job, right? You're going to get a nose job, you get the nose and you're like, oh my God, my nose looks amazing. Now it doesn't fit the rest of my face.
It's too nice.
Because like, then you realize that your face, like you want a perfect nose that's all symmetrical and whatever, but then it doesn't fit your non-symmetrical face. Because our face is like, I mean, it's not perfect. It's not like a perfect circle, a perfect oval. It is what it is, and everyone's different. So you might have more of a square face, more of a round face, more of a long face, more of a wide face. And if you get just the nose taken down, like, and like, I know that I've seen it like where you can say that someone got a smaller nose, but then it looks out of place on their face because their face is maybe wider or whatever, or maybe that's just the way they're born, whatever it is, like that kind of gives a person like a complex, like, oh my God, why do my cheeks look so big now after I made my nose small?
Not even getting into like the deep dive psychological and all that kind of stuff. Is it good? Is it bad? To me, when I see like Michael Jackson was a cute kid. He was, and he's the big case for plastic surgery. Anytime there's a plastic surgery discussion, it's going to be Michael Jackson. But he's a cute kid. Wow. He was a good looking, in his 20s.
King of pop, man.
And then he just went overboard. And to me, when I see that, it's like, like when people have a nice car already and then they try to fix it up and put a spoiler on it and lower it and put rims on it, and maybe Dayton's and put hydraulics in it. It's like, dude, the car was already nice. You've made it worse by investing money into it.
So then let me ask you this question. Is it more of a situation like this where is that just the human strive for perfection? Like when you look at a guy like Elon Musk, right? He sleeps at Tesla, he lives and breathes, and it's his obsession, right? And then some people's obsession may be their face and body. So is it just like a perfection thing where like people are like, you know what? I finally got this perfect nose. Now I need to make my ears, eyes, nose, mouth, everything needs to be perfect. And they won't rest until it's perfect.
I think definitely for some people, I think I don't know, just my own personal, in my life, I get on the obsessive end too. And so sometimes I have to pull it back and and try to find more of a balance. I think everybody kind of struggles with that, finding a balance in life.
For sure.
People who are successful, they want to work and make more money and go higher in the company, and then they got to pull it back because they're, you know, I think everybody goes through these adjustments, you know. So I think definitely with some people, they just do, they go all overboard.
Right. Yeah, I think like, yeah, it's a difficult thing. They like, you know, you see these, like when I see young kids like diving deep on this stuff and having conversations, I'm like, man, you're only 10 years old or you're like 14 years old. Like, why is this stuff even in your mind? But then I guess like every generation out there is like looking at kids like they grow up faster than the generation before them. You know, like we didn't have these kind of thoughts. But like a lot of, like honestly, like since we came to Korea, like it's become like more of an understood, like not so taboo thing. And like I remember when I first got here, I was shocked that people talked about it so openly and whatnot. And, you know, and then now here we are 10, 20 years later, where like it just seems like it's just not even an issue anymore.
So would you ever get something? Would there be anything that you would do for anti-aging? They make it very like...
Well, you know, honestly, like I never really ever considered it. I always thought that I was like, why would I ever change anything? I'm fine, you know, like I feel good. I don't, you know, need any of this stuff. Yeah, but I mean, honest. But then, you know, we invest in, you know, like skincare, masks, and all this kind of stuff. So I mean, if we're spending thousands of dollars of stuff like on like skincare, like is it that different to go get like some micro needling or some small injections? I don't know. I've had like some of my youngs, like some of my friends have done this, and they seem to really enjoy it. They see the benefit. They feel better. You know, they look great, and they're not going under the knife. So I don't know. To be honest, like I've thought about it.
I think it's funny because if I asked you, rephrase the question and said, if you could go back in a time machine 10 years ago and just kind of switch places and bring that face back, I think if I could do that like that, I think it would be it wouldn't even be a thought.
I think 100% of the people out there would say yes.
Yeah, well, why wouldn't you?
Right, why not, right?
The no surgery involved. It's just like a snap of the fingers thing, and you get 10 years younger.
Yeah, I wonder why, like, when you attach surgery to it, why all of a sudden it has like a semi-negative, or you're like, oh, surgery? I don't know. But then if you could just like snap your fingers and do it, then everyone would do it, right? What is it about surgery that triggers that in our mind?
For me, it's just that whole American tough guy Tuesday. You know, Chuck Norris never got any surgery, or maybe he did. I don't know. Like, as far as I know, Robert Redford's never. You know, all of these kind of like old school heroes, Clint Eastwood. You know, the tough guys, the American macho man. John Wayne wasn't, you know, getting surgery, I don't think.
I think it's an interesting thing because it seems like from the dawn of time, you know, like people were searching for the fountain of youth.
Yeah.
Right. So it's like, this has like been a human quest.
Yeah.
People are looking for some way to stay, you know, I mean, there's like superheroes that never aged. I mean,
you want your powers from your youth.
I mean, you got Dorian Gray. I mean, it's been written about in literature. I mean, like whatever it is, you know, people going to secret worlds where they don't age, whatever. And I think like, I don't know, maybe plastic surgery is the fountain of youth.
At least visually. Like it might not, I don't think it'll give you more pep in your step.
Well then.
But maybe emotionally it'll make you feel good, and then maybe that'll give you the pep in your step.
I mean, like how you look and what's going on inside your body are obviously different things. But then you wonder if you feel better about your visual appearance, will that encourage you to be more active and in turn help heal your body on the inside?
Yeah, I mean, those are all good points. I don't know. Like if I'm thinking about is Viagra anti-aging? Like you're basically getting your powers back from, you know, whatever, when you're, you know, younger.
Yeah, I don't know.
Like, cause I wish I could play basketball like I did when I was, you know, 25. But those days are gone. But if there was a procedure I could do to where I could get my powers back, like take a basketball Viagra pill, I would take it in a heartbeat.
They're working on that now, right? They're working
like get your jumps, get your hops back.
I think LeBron is the only one that's got that actually going on right now.
He's definitely doing something.
Yeah, I don't know what it is. It's amazing though.
Yeah, I mean, it's just.
Yeah, but I don't know. You wonder because like you, I think the bottom line is you want to feel good, you know? And I think for some people, like getting cosmetic stuff done makes you feel good. And other people going to the gym, they get the same rush. They get that same feeling. So it's like, I don't know, like my perceptions, my ideas on the cosmetic surgery and aspect is changing a lot because you see how it's obviously making people happy.
Yeah.
You know, just like when I go to the gym, I feel great. You know, I get out, I got this endorphins pumping, I feel better. I feel like I look in the mirror and I feel like I look younger. You know, I don't know if I do, but like I feel good. And if those people get the same feeling by going and getting a small procedure done, like, why not?
So is that added to the basket of wearing sunscreen, working out, eating healthy, more vegetables, drinking less alcohol, less cigarettes?
I think all those things they all kind of go hand in hand. Like, you know, the ideal way to never age is to live like a monk, right? You know, if you stay inside, don't like, you know, if you live as a monk and then get fillers and injections and have cosmetic surgery,
you're never going to die.
You probably will basically be like living in a bubble.
Yeah.
You know, I mean, like the less exposure you have to everything is obviously great for your skin. Your skin's a living thing. So I don't know. It's an interesting thing. I mean, okay, so you asked me the question, like, I've thought about these like fillers and injections. Have you thought about it? Is this something that you would entertain?
It's something that's kind of like been going around. I think maybe it's because we hit 40 and, you know, this is something that I never even really thought about, you know, when we were playing basketball and then now retired and coming back to Korea. You're seeing more and more people in our group, people that I know. Surprisingly, a lot of guys in that basket. So yeah, I mean, I think about it, but I'm just scared. You know, I honestly...
You're scared of needles anyways.
I'm scared of needles. I'm scared of doing something that might have a negative, do more harm than good for something that I don't need.
Well, also let me ask you this, like, so we're living here now, right? Where this stuff it's a topic of conversation.
Yeah.
I mean, almost anywhere you go,
Probably
right?
the best place to get it, you know, if you're going to do it.
Say you're living in Australia or living in the States, right?
I probably wouldn't even have thought about it,
right?
Honestly.
Right.
Would
so
you,
like,
do you think?
Probably not. I mean, I think like if we were living in the States, I think our environment's affecting some of the things that's going on too. It's not necessarily social media. It's just the fact that you ride the subway, there's posters. You ride the bus, you go down to Gangnam, you
bombarded,
go to the
huh?
I mean, you're getting all this information, so you're like, oh yeah, I mean, okay, you see it every day, then you start to think about it.
And in Korea, they comment on your looks more than they do in other places. They're like, you know, especially we see our hubes, like our basketball, you know, guys that we haven't seen in a long time. And they'll either say, oh, you look great, or they'll say, why do you look so tired, or something, whatever they say, right?
It's almost like in America, people don't really comment on your looks like that.
Yeah.
Because it's like not polite, right? But then people, like, the very first thing they say, they'll say hello and they'll be like, oh my God, like, why do you look so terrible? And they won't mean it in like a offensive way. It's just like, that's just like their first observation. I don't carry like no malice with it, but it's like, that's their first thought. And then like, you might be like, God, do I look bad? And then you start thinking about it. Then you kind of like, you know, go into that whole thing where like, yeah, I don't know, it might be the environment. But because they comment on it so much, you kind of have that thing in your head where you're like, you know, like I know that like a lot of times when I look in the mirror, a lot of times I'm like, oh, I got dark circles coming in. Like, I got a wrinkle over here. I got to stop smiling. It's like you start thinking about these weird things that you're like, wait a second, if I was...
Well, a lot of the stuff they tell you, like my wife's big on skincare and she's just like, don't smile so big. Stay out of the sun. I love the sun. Right. I love being at the beach. I love surfing, you know.
Zero emotion.
And I'm very expressive. So yeah, like, do I want to live or do I want to like just be in like...
I mean, if you never smile, never squint your eyes, never open them,
right? Then
of course you won't have any lines.
Yeah, and that doesn't sound like a life for me. So,
but then are these lines because so also like when I was looking at some of this stuff, they say men typically don't want to go under the knife, right? And then as far as the injections and fillers, they typically won't get them in their forehead because they want that. They'll kind of like look like that line because it kind of gives you more of a masculine look where girls will typically go for that because it gives them like a smoother look where they'll look younger and fuller. Like, I guess even in the cosmetic surgery like field, like men still want to regain some of the ruggedness. Right. So it's like, okay, well, I want to take my crow's feet, but leave the forehead lines.
Well, I always thought guys like Sean Connery were like super cool, super motion. So like, even though they have full gray head of hair, you know, Sean Connery was cool even when he was bald. And you know, just the lines and wrinkles kind of made you like
Right.
This guy's lived.
This guy's a man.
He's seen some shit.
I think when we were growing up, like, I know I had the same ideas. I was like, man, Sean Connery, these guys that look like rugged men. And then you look at a guy like Richard Gere and you're like, this guy looks too pretty.
Yeah.
But now I look at Richard Gere, I'm like, man, I wonder what that guy's skincare routine is.
Yeah.
Like, you wonder what he's doing. He's probably getting fillers and all this stuff too. Because him and Robert Redford are on the same area, and Robert Redford looks like...
They're from the same era?
I think so, aren't they? Around?
Not sure. Maybe.
Don't quote me on that. But yeah, I don't know. Okay, so we've kind of talked about some of this stuff a little bit here. Now I got a question for you. All right? We're going to play a little game.
All right.
So we're talking about cosmetic surgery and all this kind of stuff and whether or not we would have had it. And we've kind of gone back and forth on this.
Okay.
So not you personally, but if you were to take the world of cartoons and pick your top 3 cartoons that you think are eligible or that you would say, hey, look, Goofy, you need a nose job.
Oh.
If you were taking 3 cartoons, pick 3 of them and then pick what they would have to do with them. Like what procedure that you would want them to have.
Also, it's really tough because would Peter Griffin still be funny with liposuction?
I mean, he did get liposuction in that one episode.
Oh, he did?
And then he got admitted to the Beautiful
See,
Man.
that's not fair because you've seen every episode of Family Guy.
Yeah, he was
Okay, I'm going to leave him off the table.
He was different.
I'm going to leave him off the table. 3. So I'm definitely saying Homer. Just hair transplant, I think. Because I don't think the hair is what makes him funny or not. I don't think being bald makes Homer funny. I think it's more the gut and, his just expression and the 5 o'clock shadow.
Got you.
I don't think we're changing much, but we're definitely adding to his street credibility. Family Guy, I'm not going to touch Peter because I just think he's precious the way he is.
He is.
Let's say... Now I'm just like stuck on Simpsons and Family Guy. I'm going to stick with the Simpsons. Bart, I would just get veneers because the overbite, and I think he would be funny with perfect teeth. I think he'd be funny with perfect teeth.
All right.
Now I'm going to pivot back to the Family Guy because I gave Peter a pass, but I don't think I'm giving Lois a pass. I'm thinking Lois needs just a slight reduction in the nose. Not too much, Lois. You're beautiful.
Right.
You're funny.
Okay.
Lois's voice annoys the crap out of me, but I want just keep it, be who you are. And maybe the nose job, because it's very nasally. Maybe that kind of just takes the edge off it.
I'd agree. Okay, so you got Lois, Bart, and Homer. Huh?
Okay, who are yours?
I'm gonna have to agree. Like the first thing that comes to mind is Homer. Right?
But you can't do. That's not fair. You can't do mine.
No, but I mean that's the first thing that came to mind. Like that was one of mine. Like I'm thinking Homer in a hair transplant.
Okay.
I thought the same thing.
I think in some of the episodes when they go back to like when Homer was young, they show him he was like rocking out, but he was still funny because he was still the same dude.
Right. He was like the same guy, he just had hair.
Yeah.
And he was still overweight.
He was like Flanders kind of. Homer Simpson with hair is like Flanders from Family Guy, like just look wise, not voice. Okay.
I think it would be interesting to see staying on the Simpsons tip. I think it'd be interesting to see Mayor Quimby with some liposuction.
Ooh,
right.
But his whole thing is the donuts, and that's kind of Homer's thing. But
But I mean, if
just a little bit, he could lose a little bit.
If Chief Quimby, I think that he got like if he
got a 6-pack,
right. Right, I think if he was fitter, it might change the way he polices Springfield.
Yeah, clean up that town.
I think I thought about like Donald Duck. If we could do something with his voice,
is that plastic surgery though? It's not cosmetic.
It's not cosmetic. But then I was thinking like he's got this big beak, right? And like he probably has trouble eating stuff. So if we gave him teeth,
a duck with teeth. Okay.
Right.
Okay.
Maybe then he could eat stuff. He wouldn't have to.
I'm not fully on board with that because I don't know. I can't even imagine what that would look like. But okay.
Exactly. I think in him, and I'm thinking I'd probably go back to Peter Griffin because he's one of my favorite guys.
So you're going to give him the surgery that I wouldn't give him?
No, I'd give him LASIK.
No glasses.
Right. No glasses, Peter.
Does Peter always wear glasses?
He always wears glasses.
So okay, cool. The fact that I don't know that he wears glasses, that doesn't contribute to his being funny or not funny.
I think it's funny sometimes because, like, I mean, I think it'd be interesting to see what Peter Griffin would look like with.
Okay.
You know, not give him liposuction because I think liposuction adds to his hilarity. And then he did get liposuction one time, and he just turned into a different dude. I didn't like him.
He got stuck up.
He got stuck up.
I got to see that episode.
Yeah, it was pretty funny. That was a great episode. But yeah, I think if he had LASIK, I wonder what that would do to him. I wonder if that would change his personality, because you wonder about these things. Like, if you change one thing about your body, is that going to change your personality?
I think the interesting thing about this cartoon thing is I'm the only one to pick the girl, and girls are statistically more likely to get plastic surgery.
Okay, so if I had to pick a girl,
is that because we were just trying to be politically correct and not like say anything about girls, not point the finger and be like, you need to change? You're beautiful. Hey, honey, you're just beautiful just the way you are.
Yeah, I don't know. I think like we probably watch more cartoons. Well, actually, you're watching a lot more cartoons now
with the kids.
With the kids, eh? But you can't like dissect kids' cartoons, right?
Well, it's like Toy Story and like pets. So it's like, why would they get plastic surgery? They're a toy.
Well, I mean, if you gave Woody like knee replacement surgery, maybe he could run faster. He kind of looks like he has trouble running around.
Not cosmetic though.
Good point. Good point. It's tough to say. I think there's some good stuff out there with these cartoons. But yeah, I don't know. It's interesting to see where this stuff will go, where we came from to where it is now, on just how like the perceptions are changing, the affordability. You know, it's just.
I feel like in the future, it's not even gonna be a thing. Like this conversation we're having is gonna date us. It's not gonna age well. It's gonna be an irrelevant conversation. It's gonna be like going through the drive-thru to get a burger. I think in the future, like if we go 20 years into the future, I don't think people will think twice about it. It's like, yeah, it's like buying new clothes or something.
I think the interesting thing is like people assume that if you spend a lot of time in Korea that you're naturally going to have something done also.
Yeah.
And then, you know, I mean, who knows? I mean, maybe we will have something done, but I think you're right. I think like we're going to look back on this and be like, I mean, I'm even thinking about how I thought, you know, 10 years ago or when we grew up and the people that we idolize and the people that had surgery and how we like squinted our eyes and like, I can't believe they'd ever do that. Then now we're sitting in a place where it's very commonplace. It's not taboo. And yeah, see where this thing goes after that. I think it'll be, I don't know, man. Interesting. It'll be really interesting. But yeah, well, anyways, I guess that kind of brings us to the end of our podcast today. But just wanted to say thank you for tuning in. And
yes,
I guess we'll see you guys again next week.
All right.